Hi guys, good afternoon, good evening. Can you all see me? Can you all hear me? Audible, visible? Hi Syed, yeah, we will resume our BLS series as I told you before also. अपना जो BLS series है ना वो हम अपने एग्जाम सीजन के बाद शुरू करेंगे. That is after NEET PG. So we're taking a break until NEET PG point. उसके बाद we'll go full fledged into BLS again. ठीक है. तो आज का जो मास्टर क्लास है वी आर गोइंग टू डिस्कस अबाउट लैप्रोस्कोपी मतलब मिनिमल इन्वेसिव सर्जरी बेसिकली एज एन अंडर ग्रेजुएट what you should know, what are the objectives that you should know. All these are the components that we're talking about in minimal invasive surgery. ठीक है. So we'll do BLS by December. It will be finished. Don't worry about it. ठीक है. Hi, good evening guys. Good evening. Good evening. ठीक है. So in a minimal invasive surgery, we'll talk about various components. The first and the foremost important component in a minimal invasive surgery is to create neoparatonium. ठीक है. तो ये neoparatonium क्या होता है पहले ये देख लेते हैं. The word nemo basically means कि air. ठीक है. So this is mean we have to fill up the air and the word peritoneum is going to be in the intraperitoneal space. It is in the intraperitoneal space. So the word pneumoperitoneum is basically trying to tell you that you're filling up air within the peritoneal space. Now, why do you want to fill up the air within the peritoneal space? When you see across here, normally if I don't fill up the air, तो abdomen जो होगा वो collapsed state में होगा. अगर collapsed होगा तो I will not get any space to operate. In order to have more space while operating and the visualization should be better, I would fill up this entire peritoneal space or the intraperitoneal space with the air. We'll talk about what is the gas we are going to use it so that it inflates. When it inflates, it creates a lot of space, and when there's a lot of space, you will be able to operate without any problem. So pneumoperitoneum is the most important pillar in laparoscopic surgery. We will talk about various techniques. How do we create pneumoperitoneum? For now, you have to remember that pneumoperitoneum is the first step in the laparoscopic surgery. You have to create pneumoperitoneum before you start the surgery. Okay? But this topic is a complete topic about minimally invasive surgery. In NEET, you can expect 1 or 2 questions, maximum 1 question for sure. But then yeah, it is going to be helpful for sure. ठीक है. चलो, तो अब ये नीमोपेरिटोनियम बनता कैसे, हाउ डू यू क्रिएट इट? तो नीमोपेरिटोनियम बनाने के लिए व्हाई डू हैव 2 स्लाइड्स? ओके. Now, to create pneumoperitoneum, I will be using this particular instrument. ठीक है. तो सवाल ये है कि अगर आप देखोगे ये क्या इंस्ट्रूमेंट है. ठीक है. Now this instrument, as I say, what is this? This is your Veris needle. This happens to be your Veris needle. This happens to be your Veris needle. ठीक है. अच्छा, what is so special about Veris needle? Veris needle के बारे में क्या special है? When you observe the Veris needle very carefully, at the tip of the Veris needle, there is a small opening that is present, and this is what we call it as the eye of the Veris needle. This is what we call it as the eye of Veris needle. This is what we call it as the eye of the Veris needle. एक छोटा सा छेद that you can see, that small opening is called as Veris needle का eye. Now, why it is important is whatever you're going to connect into the Veris needle, this is the point of connection. From here, you can send the air, you can send the fluid, whatever you want. Now, there is a knob that is going to be present. Okay, there's a knob which is present on the Veris needle. Now, this knob, you can control it. So, let's say I have connected an gas ठीक है, एक गैस सोर्स कनेक्ट किया हुआ है, or else you have connected some water source or any fluid source that you have put, and if it's on a continuous flow, अब बार बार you cannot go close it, come back, close it, come back, because as a surgeon you want to control कि how much amount of gas you're going to put in and how much amount of gas, because every time you open ports, amount of gas will escape. I want more amount of gas to go in. So this knob is going to control. You turn the knob this side, it stops. If it aligns with the opening, it will allow the gas to flow in. If I put it perpendicular, तो अगर नॉब को मैंने ऐसे रखा हो तो बंद हो जाएगा, नॉब को अगर ओपन कर दोगे इट इज गोइंग टू फ्लो थ्रू इट, ठीक है. अनदर वेरी इंटरेस्टिंग थिंग अबाउट द वेरिस नीडल इज ये जो वेरिस नीडल का टिप है, राइट, दिस हैज गॉट अ स्प्रिंग एक्शन. दिस हैज गॉट अ स्प्रिंग एक्शन. तो बेसिकली वेरिस नीडल ना एक हॉलो ल्यूमन के अंदर एक शार्प ट्यूब है. जैसे आगे जाके हम पढ़ेंगे कि आपका जो पोर्ट है और ट्रोकार है, इट्स लाइक अ पोर्ट एंड ट्रोकार सिस्टम, एंड इट इज लाइक दिस. सो व्हेन यू इंसर्ट इट, because you're exerting pressure, it will be pointing. The minute it gives away, so this recoils back, this spring action. So I'm going to hold it down, punch it. The minute it gives away, as it goes in, this recoils back, and this recoil is going to occur because of spring action. So it's like this, the minute you go in, it goes in, ठीक है. जैसे ये बंद हो जाओगे ये पीछे रिकॉइल कर जाएगा. ये रिकॉइल एक्शन इज बिकॉज ऑफ द स्प्रिंग एक्शन. तो वेरिस नीडल इंसर्ट करने से पहले अब तीन चीजें चेक करोगे, ठीक है. क्या चेक करोगे? पहले ये ल्यूमेन खुला है कि नहीं खुला, इज दैट ल्यूमेन ओपन और नॉट. सेकंड, यू विल सी द नॉब, इज इट मूविंग और नॉट. थर्ड थिंग, यू लुक फॉर द स्प्रिंग एक्शन, ठीक है. इज द स्प्रिंग एक्शन वर्किंग और नॉट, बिकॉज we expect when it goes down, the sharp end of the needle should retract back, right? If it is not retracting back, and if you overshoot, you will cause injury to the vessels, you can cause injury to the bowel, to the viscera, any other possibility. So to prevent it, this is the basic objective that you have to look for veris needle, ठीक है. तो veris needle का मोटा मोटा ऑब्जेक्टिव यही है कि you need to make sure it's a safe technique that you're going to put across here, ठीक है. Now, if I have to summarize with respect to veris needle, वेरिस नीडल का जो मेजर काम है, इट इज गोइंग टू हेल्प क्रिएट नीमोपेरिटोनियम, और आई कैन से इट इज यूज्ड टू क्रिएट नीमोपेरिटोनियम. It is used to create pneumoperitoneum, right? Now, if you look at a bit of technicalities about the veris needle, so we'll talk about what is the outer diameter. Talk about what is the outer diameter of the veris needle. What is the outer diameter of the veris needle? What is the length of the veris needle? How much is the outer diameter and how much is the length of the veris needle? The outer diameter of the veris needle is 2 millimeters and length it varies between 70 to 120 millimeters. It is going to be 70 to 120 millimeters, that is 7 to 12 centimeters in length which you are going to get. If they ask you what is the size of the veris needle in terms of gauge, remember it is the largest bore of the needle that you can have. That is like a 14 gauge needle. That is a 14 gauge needle. So veris needle का जो outer diameter of 2 millimeters का है, इसका जो length होगा that is going to be 7 to 12 centimeters, and the size of the veris needle is going to be a 14 gauge. It is going to be 14 gauge. Guys, BLS will continue after our NEET PG. We have told you, I mean, we'll give you a formal date also. लेकिन अभी क्योंकि exam season चल रहा है, they were trying to help all the NEET PG aspirants. तो जब तक वो खत्म नहीं हो जाता, I cannot rush with BLS. तो वो थोड़ा overlap है. BLS हम करेंगे, but that will happen from after your NEET PG exam. ठीक है? चलो. So this is about veris needle. Now, अगर मैंने आपको veris needle दिया and I'm asking you to hold, can you hold the veris needle? Make it more easier. I'll give you this. Let's say ये आपका veris needle है. I'm asking you to hold veris needle. What is the position or how do you want to hold it? Do you want to hold the veris needle like somebody you're going to stab, or do you want to hold it like somebody you're going to point it out, or how do you want to hold it? You hold it like a dart. Like if I want to throw, like, you know, if imagine there's a dart, अगर आपको dart पे फेंकना है तो what is your grip? This is your grip. ठीक है? This is how your grip of the veris needle will look like. ठीक है? Like you want to dart it across. So hold like you're going to throw a dart. Now this is the position of the veris needle. This is how you hold it, as if you're going to throw it on a dart. ठीक है? So that's about the position of the veris needle. So second thing that you're going to ask is what or how you're going to hold. This is how you hold the varus needle. This is the position how you hold the varus needle, and this is what we call it as the dart holding position. This is what we call it as a dart holding position. This is how you're going to use a dart holding position. What are the fingers that you're going to use, right? You're going to use your thumb. You're going to use your thumb, your index finger, and your middle finger. ठीक है, तो आप thumb, index और middle finger को लेके पकड़ोगे. This is how you're going to hold it. These two fingers are going to remain free. ठीक है, अब stop अभी मतलब जैसे fingers देख के ये नहीं शुरू हो जाना जो नया अभी ट्रेंड चल रहा है ना, एक जूझा तू जूझा पता नहीं whatever it is, right? So hold it like a dart and then you're going to throw it. ठीक है, फेंकना नहीं है, पकड़ के रखना है. This is very very important. ठीक है, now once you have the varus needle, how are you going to insert the varus needle into the abdomen? Okay, so how do you insert it? This is the position that you're going to insert it. Now, this diagram is not also entirely true, because what I'm going to do is I am going to pinch the abdominal wall and I'm going to lift the abdominal wall like this. Okay, what I'm going to do is I am going to pinch the abdominal wall and I'm going to lift the abdominal wall like this. ठीक है, तो आप abdominal wall को pinch करोगे और उठाओगे. Now the interesting thing is there are two angles that you should know, right? First of all, when you're inserting the varus needle, in which direction would you like to insert? So this is the head end of the patient. Just for the sake of understanding, this is the head end of the patient, and this is the foot end of the patient. Okay? So this is the head of the patient, this is the foot end of the patient. You will always point towards the pelvis, right? So the insertion of varus needle, it should be pointing towards pelvis. It should be pointing towards pelvis, right? Now, as it is going to point towards, why do you want to point it towards pelvis? ऐसा क्या है? What is so special that you cannot point towards the Ziphy sternum, you have to point towards the pelvis? It is a basic common sense, right? I am worried that when I'm inserting the varus needle, if I overshoot, I'll go deeper. And if I'm going deeper, say I put an angle, we'll explain the angle, but if you overshoot, you go into pelvic organs. And the pelvic organ, we are talking about bladder. Even if the bladder gets injured, you don't need to worry about it. Put a Foley's catheter, you can manage. Imagine, on the other hand, I put the varus needle like this, and if I overshoot, I'm going to go into the Ziphy sternum and then shoot into the diaphragm, and above the diaphragm you have mediastinum, you go puncture the heart. You don't want to kill your patient on table. Correct? Common sense. इसलिए वेरिस नीडल को जब भी आप डालोगे आप pelvis की तरफ point करोगे. You don't want to point towards the Ziphy sternum because if it overshoots, it will cause injury to the heart. ठीक है? अच्छा. Now the technical point that they'll ask you is what is the angle of insertion of varus needle? तो ये जो angle of insertion है ना, so you have to understand the angle between varus needle. The angle between varus needle and body, it is going to be 45 degrees, right? You can see between the body. So this is the axis where you're taking the body. So this is the body axis. So between the body, you can see between the body and the needle, it is going to be 45 degrees. Absolutely correct. Now, sorry. If they want to make your life difficult, they will ask you what is the angle between the varus needle. What is the angle between the varus needle and the skin at the entry? Now this is going to be 90 degrees. Now I want you to look here. When you look across here, right? So when you look across here, this is the skin that you have pinched it, right? So this is the axis of the skin that you have pinched, and this is the needle. So between the needle and the skin, the angle is going to be 90 degrees. So you point towards the pelvis, The angle between the needle and the body is 45, and the angle between the varus needle and the skin, it is going to be 90 degrees. Dharmjit Yadav, we will continue the BLS series. It is going to happen for sure. We will make sure it happens. लेकिन अभी क्योंकि एग्जाम सीजन चल रहा है, मैं वही बता रहा हूँ बार बार कि बेटा एक बार हमारा नीट पीजी एग्जाम हो जाए, उसके बाद हम BLS अपना वापस शुरू कर लेंगे. ठीक है, until this point हमको थोड़ा बहुत we have to pull back. ठीक है, so this is about how you are going to insert your varus needle. ठीक है, now the same thing I can demonstrate in the picture. You can see I'm pinching the skin. ठीक है, if you're able to see, skin को ऊपर उठाया है और varus needle को डार्ट की तरह पकड़ा है and you're inserting it. Now the beauty of this diagram I wanted to keep is, look, this is the axis of the skin and this happens to be the axis of the varus needle, right? This happens to be the axis of the varus needle, and the angle between these two, the angle between these two is a 90 degree angle. ठीक है, तो अब देखोगे ये स्किन का एक्सेस है, ये वेरिस नीडल का एक्सेस है, बॉडी और इफ आई से द बॉडी एक्सेस, इफ आई जस्ट टेक इट हियर ओनली, अगर आप बॉडी का एक्सेस देखोगे, दिस इज हाउ द बॉडीज एक्सेस इज देयर. अगर बॉडी का एक्सेस देखोगे, दिस इज द एंगल बिटवीन नीडल एंड द बॉडी, the angle between needle and the body is 45 degrees. ठीक है, the angle between the needle and the body is 45 degrees, but angle between the needle and the skin is 90 degrees. I hope everybody is clear with this point. ठीक है, बहुत इंपॉर्टेंट है, देखने में बड़ा सिंपल लगता है, लेकिन अगर कल को अगर उसको नीट पीजी में सवाल पूछना है, या फिर अगर आप वार्ड में हो, इफ यू आर ओटी में हो, if you are the surgeon who is going to operate, or your professor who is going to operate, or your AP is going to operate, if they ask you a question, you should be able to answer this. ठीक है, नॉन नेगोशिएबल है. ठीक है, चलो, now once you have understood the ergonomics of how you're going to insert the varus needle, how do you confirm that the varus needle is inside the peritoneum? Now why I'm telling you this is, when you're going to insert the varus needle, you need to understand that the varus needle will go through various different layers that you have. For example, the outermost layer is going to be the skin, and this is how the skin would look like. Skin के नीचे you have subcutaneous fat, which is divided into two components. You have the superficial campus and the deep scarpa. तो ये आपका campus layer हो गया. Below the campus you have the fibrous scarpa that is present. अब subcutaneous fat के नीचे, on the either side you have the set of muscles. In the lateral abdominal wall you have the external oblique muscle, you have the internal oblique muscle, you have the transverse abdominis muscle. Okay. The three sets of muscles which are present, they are the external oblique muscle, you are the internal oblique muscle, and the transverse abdominis muscle. Dead in the center you have the rectus abdominis muscle. So these are your rectus abdominis muscle, which are medial abdominal wall muscles. On the lateral side again you have the same thing. You have the external oblique muscle, you have the internal oblique muscle, and then the transverse abdominis muscle. So you have the external oblique muscle, the internal oblique muscle, and the transverse abdominis muscle. Now obviously when you look at these two components, you will see from this side you have the anterior rectus sheath which is present, or पीछे you have the posterior rectus sheath. All these rectus sheaths are basically a combination of the aponeurotic tissue that you'll see from the external oblique, internal oblique, and the transverse abdominis. So this is like this, right? If you want more details, you can go and see on our BLS abdominal wall anatomy. You will see much more clear. Okay? Now, below this you have your fascia transversalis, which is going to be continuous, and below the fascia transversalis you have the preperitoneal pad of fat. So there is a layer of fat that is present. There is the preperitoneal pad of fat that is present, and below this you have the peritoneal layer. This is the peritoneal layer is present. Now when I take the varus needle, the path of the varus needle is going to be like this, piercing the skin into the rectus and into the peritoneum. So it has to pierce all these layers. ठीक है, क्या layer pierce कर रहा है? Skin, subcutaneous fat, anterior rectus sheath, then you have the posterior rectus sheath, fascia transversalis, preperitoneal pad of fat, and in the peritoneum. So at the end it is piercing the peritoneum. My question to you is, how do you know that you have pierced the peritoneum? ठीक है. Now, as soon as you go in, how do you know you have pierced the peritoneum? There are two things. While inserting the varus needle, when you're going through all these, there are two click noises that you will see. So we call it as two click sound. What are the two click sound? The first click you will see when you're going to pierce the rectus abdominis muscle. So it is called as a rectus click. It is called as a rectus click, that you will see a click noise is going to be present. After the rectus click, the second giveaway is going to be at the peritoneum. So it is called as the peritoneum click. So when you see two click noises, you should stop exerting more pressure, क्योंकि इसका पतला मतलब क्या है कि आपने दो जगह pierce कर दिया. Once you pierce this is the rectus click when you pierce the rectus, and then when you pierce the peritoneum, you'll see the second click. But this is not good enough. ठीक है? So in order to confirm, we have two tests. ठीक है? Now, how do you confirm whether it is inside the peritoneum or is it within the abdominal wall? In order to confirm, I can perform two tests. Number one is what we call it as the saline irrigation test. Number one is a saline irrigation test. Number two is what we call it as a saline drop test. So the first test that you do is a saline irrigation test. The second one, what we do is called as a saline drop test. ये saline irrigation test क्या होता है? Saline drop test क्या होता है? Now, in a simple context to make you understand, let's say this is the abdominal wall. Okay? Let's say this is the patient that we have, and I'm just giving you a heads up here. This is how the patient has been depicted. Okay? Now, let's say this is the patient who is present here, and the innermost layer we all know it as peritoneum. So I'm just going to depict it. मान लो कि ये आपका peritoneal surface है. Okay? Now what you're going to do is, after inserting the varus needle, let's say this is where the umbilicus is present. After inserting the varus needle, let's say I have inserted the varus needle and the varus needle has gone through the umbilicus and it is inside the peritoneum. Okay? How do you know it is inside the peritoneum? Is you do saline irrigation test. Right? What is a saline irrigation test is? Let's say this is the varus needle that has gone inside. Right? I will take a syringe, which is, let's say, a 10 cc syringe, and I'm going to connect the 10 cc syringe to this varus needle. Okay? Now this 10 cc syringe, I will take 5 cc. I will take 5 cc of fluid inside this. Okay? So I've taken a normal saline of 5 cc inside this. I will try to press it. Now, because I am able to press it across, let's say this is the fluid that we have taken in. Okay? Okay. Now, as I'm going to press the needle, क्या होगा? Because it is inside the abdominal cavity, पूरा space ही space है. I should not feel any resistance. It should be able to flow freely. There will be a free flow of the fluid, and you see the fluid is going to flow through the varus needle and it is going to go into the peritoneum. There is no resistance, right? And on the other hand, when you pull it back, जब आप इसको needle को withdraw करोगे, or I can say when I pull my needle backwards, or when I withdraw my needle, or when I withdraw my syringe, basically I should only get air. तो जब आप प्रेस करोगे, आपको कोई रेसिस्टेंस नहीं मिलना चाहिए. The fluid should freely flow into the abdomen, and when I aspirate, I should get air bubble. इसका मतलब क्या है? It is inside the hollow space. ठीक है? It is inside the hollow space. Guys, I'm so happy to see a lot of overwhelming response for BLS. A lot of students are coming and asking about BLS. I do understand. See, BLS is very close to my heart. I told you at the beginning also, we will continue BLS until we finish entire Bailey and Love. It is non-negotiable. लेकिन अभी exam series चल रहा है. Our NEET PG exam is right around the corner. तो अभी पूरा exam series है. तो इसीलिए हमने BLS इस महीने के लिए रोक रखा है. Once the NEET PG is done, we'll switch back to our BLS. ठीक है? That is going to happen. Clear है? So this is called as the saline irrigation test to confirm that it is inside the peritoneum, right? You can see here, same fluid liya hai, we are pressing it, it should go freely. When I aspirate, only air bubble should come. एक और saline drop test. Saline drop test में, if you see very carefully, on a resting position, when I put the saline drop, the drop is visible. Okay. Now, how do you conduct this saline drop test? Is the same concept. we'll try to understand and give you a different prospect. Okay? Now, because I've only inserted the varus needle, I have not created the pneumoperitoneum. Let's say this is the status of the patient. Patient is lying down supine. Okay? Now, obviously, all the internal organs, let's say I'm just showing you the bowel is present here. The bowel wall is here. The peritoneum is going to be present here, and let's say this is where the umbilicus is present, and I've inserted the varus needle. Now, when I insert the varus needle, this is the position of the varus needle that you can see. Okay. So I've inserted the varus needle. The varus needle has gone inside, and it is here. Okay. Now, because it is resting, the varus needle is inserted here. It is resting, and this is where you have. When I put a saline drop, you see the saline drop is going to be here. It cannot slide freely because it is getting obliterated by underlying component or structure which are present. Okay? Now what I'm going to do is I'm going to hold the abdominal wall and I'm going to lift it up. Now when you do this, जब आप abdominal wall को पकड़ते हो और lift करते हो, तो what is going to change? Let's try to understand. ठीक है, तो everything remains the same. तो ये हमारा patient लेटा हुआ है. ठीक है, ये abdominal wall जो थी, so what I've done is I have held the abdominal wall here and I've lifted the abdominal wall from here. तो मैंने यहाँ से abdominal wall को ऐसे lift किया. ठीक है, I have held the abdominal wall and I've lifted up. ऐसे पकड़ के ऊपर खींच दिया. अब जैसे ही मैंने इसको ऊपर खींचा, ठीक है, जो आपका वेरिस नीडल यहाँ पे था उसको अभी स्पेस मिल जाएगा, राइट, बिकॉज यू हैव पुल्ड इट अप, द वॉल के साथ वेरिस नीडल लगा हुआ है, तो बावल जो वो नीचे चला गया, यहाँ पे है. ठीक है, सो देयर सम स्पेस दैट इज प्रेजेंट. नाउ बिकॉज देयर सम स्पेस व्हिच इज अवेलेबल, ये जो सलाइन ड्रॉप यहाँ पे पहले दिख रहा था, the minute I lift the abdominal wall, you will see the saline drop will pass freely and it will disappear. जैसे आप उठाओगे, the saline drop will slide, and this is what we call it as a saline drop test. ये तभी possible है जब आपका needle intraperitoneal है. आई बात समझ में? ठीक है, तो मोटा मोटा कॉन्सेप्ट यही है कि आप कैसे कंफर्म करोगे कि वेरिस नीडल इंट्रापेरिटोनियल है कि नहीं है. एक हमारा सलाइन इरिगेशन टेस्ट है, दूसरा हमारा सलाइन ड्रॉप टेस्ट है. ठीक है, बोथ ऑफ देम टेल्स यू दैट वेदर द नीडल और वेदर द वेरिस नीडल इज इंट्रापेरिटोनियल और नॉट. इज दैट क्लियर? ठीक है, इतना ही कॉन्सेप्ट है इन टर्म्स ऑफ अंडरस्टैंडिंग अबाउट द वेरिस नीडल. ठीक है, नाउ वंस यू हैव इंसर्टेड द वेरिस नीडल, नाउ आई एम गोइंग टू कनेक्ट टू एन इंसुफ्लेटर. ये इंसुफ्लेटर क्या है? ये आपका जो गैस का सोर्स है. ठीक है, तो यू आर गोइंग टू कनेक्ट इट, I am going to connect it to a gas source. I am going to connect it to a gas source. और इसी गैस से आप अपना नीमोपेरिटोनियम क्रिएट करोगे. ठीक है, सो ऑब्वियसली व्हाट आर द क्वेश्चंस आस्क्ड? व्हाट इज द मोस्ट कॉमन गैस यूज्ड टू क्रिएट नीमोपेरिटोनियम? द आंसर इज कार्बन डाइऑक्साइड. ठीक है, तो व्हाई कार्बन डाइऑक्साइड? इसके 100 रीजंस है. आई डोंट नीड टू टेल यू that it is going to be cheap, it is easily available, non-combustible, all that is important. But my interest lies कि what are the other gases that we can use. ठीक है, कार्बन डाइऑक्साइड तो चलो ठीक है, it is the most common. What are the other gases that you can use? The other gas or the second most common you can use is argon. ठीक है, the second most common gas that you can use to create pneumoperitoneum is argon. The other noble gases that you have, आप helium use कर सकते हो. You can use nitrous oxide. बेटा पहले ऑक्सीजन भी यूज होता था, बट नाउ ऑक्सीजन इज ऑब्सोलीट क्योंकि इट इज कंबस्टेबल. तो अंदर जाके आपको कबूम नहीं करना है. ठीक है, तो ऑक्सीजन यूज नहीं करना है, बट दीज आर द अदर गैसेस दैट यू कैन यूज टू क्रिएट नीमोपेरिटोनियम. ठीक है, अच्छा, फिर सवाल आता है कि जब आप कार्बन डाइऑक्साइड यूज करोगे, when you're going to use the carbon dioxide, what is the flow that you're going to keep? So when you connect it, पहले initially धीरे start करेंगे, right? We call it as the initial flow rate. The initial flow rate of the carbon dioxide to create pneumoperitoneum, it is 1 to 4 liters per minute. लेकिन imagine if you want to create pneumoperitoneum immediately, मतलब it's some emergency, you want to enter the abdominal cavity as early as possible, so you can increase this flow rate and we call it as the maximum flow rate. देखो जो maximum flow rate होगा, that can be taken up to 20 liters per minute but not beyond that. Either ways, make sure that your intra-abdominal pressure should remain between 12 to 15 millimeters of mercury. Do not overshoot from this. ठीक है? So इंट्रा एब्डोमिनल प्रेशर जो होगा वो 12 to 15 मिलीमीटर ऑफ मर्करी पे रखोगे. ठीक है? So this is about the carbon dioxide. ठीक है? What is the initial flow rate? What is the maximum flow rate? And how much should be your intra abdominal pressure? How much should be your intra abdominal pressure? ठीक है? So once you have put the carbon dioxide, the abdominal will distend and your pneumoperitoneum is created. ठीक है? So that was the step number 1 in order to gain access into the abdominal cavity. We have not got access yet. अभी हमने सिर्फ नीमोपेरिटोनियम क्रिएट किया. ठीक है? मतलब अभी एब्डोमेन के अंदर हवा भर दी है और एब्डोमेन गुब्बारे की तरह फूल गया. इतना ही हमने किया है, इसके बियॉन्ड कुछ नहीं किया. तो अब मेरी बात है कि मुझे पोर्ट डालने हैं. ठीक है? So in order to put, that is for the port placement, we'll try to understand about the port placement. There are a lot of important ergonomics that you have to follow in port placement. I'll try to touch upon the important ones. Then think about it. ठीक है? तो ये आपका umbilicus हो गया. ठीक है? This is the midline. I'm just showing you previous laparotomy scar. ठीक है? Normally we say that if there is a virgin abdomen का मतलब है previously no surgeries has been done. ठीक है? If this is the status and this is the umbilicus, usually the first port that we place, it is going to be what we call it as the umbilical port. Okay? अब यही पोर्ट है जहां से आप अपना कैमरा डालोगे. तो अगर normal without any previous abdominal incision or scars, then I would like to put my port in your umbilical port. Now imagine if a patient had a previous laparotomy. Any patient who have a previous laparotomy, where would you actually place your port? Patient has already went or already उसको previously एक laparotomy हो रखा है. So obviously this part of the abdomen is hostile. तो यहाँ पे if I try to put the port, no, I will go and cause damage because there will be a lot of adhesions and that adhesions are not safe. ठीक है? So previous laparotomy वाले patient के लिए I have 3 options, right? The option number 1, I can put something called as a Li Huang port, or something called as the Li Huang port. The second port that you can place is your Palmer's point. And the third place that you can put is your Jane point. ठीक है? So you have Li Huang, Palmer's and the Jane point. अब ये कहाँ पे है? Where would you find? ठीक है? Now just for the sake of understanding, we say this is the midline. This is the midline for our sake of understanding. On the either side, I can say this happens to be your mid-clavicular line. So this happens to be the right mid-clavicular line. This happens to be your left mid-clavicular line. See, these are mid-clavicular line. This is your midline that we have placed. Okay? So where is your Palmer's point? The Palmer's point, you will see that it will be in the subcostal region. Okay? ये आपका Palmer's point है. It is going to be in the subcostal region. Then you have the Li Huang port. The Li Huang port's dimensions, we are going to tell you about the laparotomy. It is going to be slightly high up. This is your Li Huang port, or I can say slightly lower. Here will be your Li Huang port. And at the level of umbilicus, you will see another port which is present here. This is your Jane's port. Okay? The 3 pointal ports that you have, which you can put. I'll just number them, which I've given you here. तो आपका जो Li Huang port है, this is your Li Huang port. This is your Palmer's port. This is your Jane's port. ठीक है? तो ये 3 पोर्ट है. If there is a midline laparotomy, these are the sites that you can actually place. ठीक है? तो ये जो Li Huang port है, where do you find it? ठीक है? Li Huang port, if you take from the xiphisternum to the umbilicus, you divide this into equal half. From the umbilicus to the xiphisternum, आप xiphisternum को ले लो, umbilicus ले लो, ठीक है, दोनों का मिड पॉइंट ले लो. At this midpoint, you will have your Li Huang port. So Li Huang port is midpoint, or I can just put it here. It is going to be a midpoint between Ziffy sternum, and umbilicus. Between the Ziffy sternum and the umbilicus. As simple as that. Okay? That is your Li Huang port. Palmer's point, on the other hand, which is here. This is your Palmer's point. The Palmer's point is going to be placed in the, this is the right side, this is the left side. It is the left subcostal in mid-clavicular line. Which is going to be 3 centimeters below the costal margin. This is the costal margin that you can see. ये आपका costal margin है 3 centimeters below the costal margin. That means the distance between this point to this point is going to be 3 centimeters. Just give me 1 second, guys. All right. So Palmer's point, the Palmer's point is 3 centimeters below the left subcostal margin in the midclavicular line. Okay. Then you have your Jane's point. Okay. So this is what we call it as. This is what we call it as Jane's point. Okay. So this is your Jane's point. So where is your Jane's point exactly? So when you look at the Jane's point is going to be at the level of umbilicus. So you draw a line that's going to pass through the umbilicus. So this is at the umbilical line. So you will find this at the level of the umbilical line. Okay. But where would you see from the umbilical line? So what you have to do is you have to mark anterior superior iliac spine. This is anterior superior iliac spine around 2 to 5 centimeters. This is going to be 2 to 5 centimeters, which is going to be from the anterior superior iliac spine in the umbilical line. So what you do is, if I have to put it in a perspective, if this is the abdomen, this is your anterior superior iliac spine, ASIS. From the anterior superior iliac spine, let's say this is the umbilicus, and this is the line that is going to cross the umbilicus. Correct? This is the line crossing the umbilicus. What I'm going to do is, from the anterior superior iliac spine, approximately 2 to 5 centimeters. So this is your 2 to 5 centimeters. I've marked a point. And this point, I am going to extend it so that it intersects the umbilical line. And the point of intersection between these two is what we call it as your Jane's point. This is what we call it as the Jane's point. ठीक है, तो जब भी कोई लेप्रोटमी हुई है और आपको मिड लाइन पे एक्सेस नहीं मिल रहा है, द 3 फेमस एक्सेस दैट यू कैन डू, द ली हुआंग पोर्ट, द पामस पॉइंट एंड द जेन्स पॉइंट. ठीक है, तो ली हुआंग पॉइंट, द पामस पॉइंट एंड द जेन्स पॉइंट. इज दैट क्लियर? दिस इज अबाउट द एक्सेस in order to create or take into the laparoscopy. Clear? The same thing if I show you in an image. ठीक है, so this is how you will be seeing across here. देखो previous laparotomy scar है, तो Li Huang point, if you look at this as we have described it, the Li Huang point, this happens to be the Ziffy sternum. ठीक है, So between the xiphisternum, if I point it down, midway between, that is half from here and half from the umbilicus. The midway between the umbilicus and xiphi, you have your Huang's point. Palmus point is going to be, this is your left subcostal, around 2 to 3 centimeters. As I said, from the entire component that you have, that is 3 centimeters below the subcostal. This is 3 centimeters below the subcostal line, right? In the midclavicular, you have the palmus point. Here, it is going to be, Jane's point is around 2 to 5 centimeters from the anterior superior iliac spine, and the line that is crossing the umbilicus. There is a midpoint between these two. This is your Jane's point. ठीक है? आई बात समझ में? ठीक है? तो जब भी कोई लेप्रोटमी का scar है and you are not able to gain access, I will not use umbilicus because this is now gone. तो अगर एक इंसिशन ऊपर नहीं है तो ली हुआंग ले सकते हो, अगर है पूरा तो आप पामस ले लो, अगर पामस में भी पुराना कोई आपने if you have put a makuchi incision or if you have gone to a rooftop incision, ठीक है, if you have done 2 surgeries, then in that context if everything is hostile, then you can go with Jane's point. ठीक है, the 3 different points from where you can actually take the access. Is that clear? Is that clear? ठीक है, so this is with respect to access in your laparoscopy. Is that clear? So I wanted to give you a basic objective of how to insert a Veress needle, and if there is a previous incision which has been there, how do you overcome that so that you can gain access. Okay? So this is for today that we wanted to discuss about the minimal invasive surgery. We're going to continue the series of clinical masterclass where I will come up with another series next week. We'll discuss about port placement, ergonomics of port placement, how do you visualize inside the abdomen, and if there are injuries, how do you go across it, what are the various instruments और उनके क्या-क्या use हैं, ठीक है? So that is what we're going to take it in the next series, right? So thank you so much for joining today. We will resume back next week with another class of clinical series. Thank you guys. Yeah, I do get it. We need a lot of BLS, BLS, BLS. I get it. But BLS will happen at the earliest beta. ठीक है, चलो, take care, have fun, bye.